Good morning, Emily. Thank you for everyone joining today. This is our last webinar for June. This is the fourth webinar we're having, and today we have the pleasure of presenting Emily Henderson, who is our governmental affairs consultant at McCall Hamilton. We had a long-standing partnership with McCall Hamilton and appreciate Emily's hard work. She advocates on behalf of our issues at the legislative and department level, and she's a graduate of Michigan State University and a Michigan Political Leadership Program fellow. She brings strong advocacy experience and a passion for equitable healthcare and sustainability. Good morning, Emily. Thank you.
Good morning, everyone. It's great to be here today. I am excited to give this presentation again. Obviously, we are in a new legislative session, so things have changed. And my biggest goal today is to give you an overview of what's happening right now in the state. While we are awaiting some federal changes that are potentially coming, but I also want to make sure that you all have the tools to be an effective advocate in a space where we have a lot of uncertainty. So my presentation is going to cover a couple different things today. But I will kick it off with what is happening in Lansing and kind of give you an overview of the landscape before we get into some advocacy. All right. So I'll first cover our current Michigan government landscape, and this includes our executive and our legislative branches. So in Michigan, we have our legislative branch, which consists of our House and Senate. Then we have our executive branch, which consists of the governor's office, as well as our key state departments, which also includes elected officials and appointed officials. So, for the past couple of years that I've given this presentation, Governor Gretchen Whitmer has remained our governor, and she is of the Democratic Party. And under her leadership, she oversees within the executive branch a number of key state departments and agencies. And that includes our Department of Health and Human Services, which includes behavioral and physical health and aging services, medical services, which is our Medicaid program, and then our Bureau of Children's health policy and support system. And then we also work closely within the Michigan Department of Education. And all of the different, subgroups within that department, we especially focus on special education and access to education for students. So I wanted to point out some names that should be pretty familiar to many of you. And some of these individuals, I believe, have presented this year and previous years for the ARC. And so under the direction of the director, Elizabeth Hertel, she has a wonderful team with years of experience in advocacy, health policy, Medicaid, and administration. And so I wanted to list those individuals for you all on the screen. As we talk about different policy items moving, especially on the regulatory side, a lot of these names might pop up in some of those memos, and so I wanted to make sure that you all kind of had a list of who these key players are in the state. And these are all individuals that within my role supporting the ARC and then the different subcommittees that the ARC has, these are individuals we regularly interact with. And these are individuals who are well equipped to work with us and understand the issues that the ARC is working on in the health and human services space. So that is our executive branch in a nutshell. We obviously have some other key departments that the ARC isn't necessarily always involved with, but I just wanted to highlight those key groups for you all this morning. I also wanted to highlight for you what our legislative branch looks like. So Michigan is fairly unique. If you take a look at this map, we are only one of a few states that are full-time large staff legislatures. So 365 days a year, we are pretty much prepared to have our legislature in session. So that consists of our House and our Senate in the state of Michigan. And you can see there are many other states that for the most part are hybrid. So they might do a couple months on in the year, a couple months off. But Michigan is just one of 4 states where we dedicate we kind of prepare to see people in Lansing and work on policy almost every single day of the year. So when we look at our legislative branch in the makeup, House Democrats, they had an election in 2024, and they lost their majority in November. And we actually had Republicans pick up a number of seats, especially some of those key crucial seats. And this comes off of a Democratic trifecta. So Governor Gretchen Whitmer won her reelection. We had the Senate Dems pick up seats, and they won majority a couple years ago, as well as the House. But again, as I said, in 2024, the Senate and the governor's office, they were not up for reelection, but the House was, and that is where we saw House Republicans pick up a number of seats. And so I did want to note for you that our House is elected every 2 years and our Senate's elected every 4 years. So as we look to the election coming up in November 2026, we will have all of our members, the executive branch side. I'm sure you've all been seeing the news around who's jumping in on the governor's race, both on the Democratic and Republican side of the ticket. And, we also have our Senate and our House up for election as well. And that also coincides with federal elections. I'm sure you've been hearing of all the individuals, whether they are currently state legislators or they want to move from the House to the Senate in DC. They have announced their campaigns. We're expecting more announcements to come this summer and into the fall. But we're going to have a big election year in 2026. And so we just saw the House Democrats lose that majority. And so it'll be very interesting to see how the next couple years play out, especially as we continue to get updates from the Trump administration and changes on the federal level and how that will impact a state like Michigan that is a purple state. We are a swing state. We see our parties, whether it's the governor's office or our legislature, change a lot. We have a lot of seats that are really close races. And so 2026 will be an interesting election cycle. And then, so where we are currently now, as I mentioned, Republican House majority, the Senate still has our Democratic majority. We did see, though, in 2024, one member who I'm sure has served and maybe now serves many of you that are on the call, former State Senator Chris McDonald-Rivet won her election to Congress. And so the Democratic majority in the Senate used to be 20-18. It is now 19-18 because former Senator McDonald-Rivet left to go to DC. Or represent her constituents in DC. And a special election has not yet been called for that seat. That is one of those seats that's a close 50-50. It could swing Democrat or Republican depending on other factors outside of the state of Michigan, most notably things happening at the federal level. And so, we can assume there's some hesitancy for the governor to call a special election for that seat because that would leave the chamber if a Republican does pick up that formerly democratically held seat, that would leave the Senate with a 19-19 split, which would require Lieutenant Governor Garland Gilchrist to serve as that tie-breaking vote. All right, so that covers, pretty much the key issues as it relates, or the key items related to our current landscape. I'll now dive into some of our advocacy issues that we are working on to give you an overview of what's happening this legislative session and what we can expect to see happen the next couple of months here in Michigan. So first, our key legislative issues. This is not a, entire list of everything we are working on. It's not totally comprehensive. This is just a number of items that have been introduced or started to move in the House and the Senate. We are in a very interesting time with split state government where at this point in time, we'd probably see a lot of these bills already get a lot of traction, and that unfortunately hasn't been the case. And so this is not an exhaustive list. Again, there are still many items that we are watching and looking out for that have been moving, but I wanted to just highlight a handful for you today, not to overwhelm all of you. So I did list those bill numbers for things that have already been introduced and have started to move. We have personal protection orders for vulnerable adults. This is something we saw last legislative session, but because we started a new session at the start of 2025, all the bills had to be reintroduced. They got new numbers. And so that legislation has been moving on the Senate side. We have the Recipient Rights Advisory Committee membership. This would add the ARC, Disability Rights Michigan, and the Mental Health Association in Michigan to the state's Recipient Rights Committee. And that has been introduced in both the House and the Senate, but we have already seen the House considered those bills, and we're actually waiting for a vote on those bills on the House floor. It made its way out of committee unanimously. And in that same vein, there's a second part of that package is the informed consent for mental health treatment. This is to ensure that individuals who are entering mental health treatment or in a time of crisis, that they are well informed of their rights. Most of the time when an individual is entering treatment or they're in that crisis state, they are not fully aware of what their rights are, how they can leave treatment, and what everything is what is all entailed in that process. And so this bill would require written and verbal instruction on what consent is being given for mental health treatment. So that is another bill that is moving alongside House Bill 4218 in the House. We're also waiting for a vote on that one. We also recently saw the reintroduction of guardian and conservatorship bills. This is just changes to EPIC, not our mental health code. And I did list that bill package there. Again, it was just introduced the other week, so we don't have anything scheduled right now. And we are actively working with our bill sponsors on that bill package to make sure that all of the individuals served by the ARC and those individuals that we work with are covered, protected under what this bill would change. And we've also, we always keep tabs on some big issues happening in the state. And one of those is related to voting rights and access. We recently saw a couple months ago, House Republicans made a move to introduce House Joint Resolution B, which would require proof of U.S. citizenship through documentation and paperwork in order to vote. That currently is not something that stands. We actually recently saw the courts rule that that's something that's unconstitutional to require someone having a passport to go to the voting booth to cast their vote. And this is something that House Republicans wanted they had to get 3/4 majority of their chamber to vote in favor of in order to get it moved forward for potential ballot proposal. So this did not get the votes needed. It passed along party lines. And so, we still keep an eye out for any voting rights issues, but that was the most recent advancement. Republicans tried to move something in the state that didn't really get very far, but still keeping an eye out for anything that could potentially come forward in that space. So we look at budget priorities, and I will cover the legislative process and the budget process in the later part of my presentation here. So we'll come back to these items. But I wanted to highlight some things that we are working on in Lansing as it relates to the budget. Number one right now is protecting Medicaid. I know you all that are on this presentation today have been following the conversation federally. We have major concerns about any changes to the Medicaid program that could come down to the state of Michigan and impact those who receive their insurance through the Medicaid program. And so this is number one priority. The ARC is a member of the Protect My Care Coalition. This is a coalition of, I believe at this point, over 200 stakeholder organizations that are working towards advocating for protecting Medicaid in the state of Michigan and making sure we don't have any drastic impacts to the state into the program. And so that is something we are closely following in our state budget process, which is still unfolding and we expect to continue throughout the summer. We continue to monitor and advocate for an increase for the direct care worker wage. A couple of years ago, we received under Republican leadership in the Senate a $2.35 increase that was largely through federal funding and ARPA dollars that came from the COVID-19 pandemic. And then just a couple years ago, we received an additional 85-cent increase for that wage. We continue to advocate for that $4 increase to get up to $20 an hour for that wage. That would be about $100 million of our state's general fund that the state would have to allocate towards that item in the budget. And unfortunately, with where we are right now, with the uncertainty coming down from the federal government, any cuts to Medicaid would drastically impact our state's revenues. And so we are monitoring the situation, obviously still advocating for that increase in the budget, but recognize that there are a lot of factors that are up in the air right now. And so we continue to advocate again for that piece, but recognize that protecting Medicaid is that number one priority at this point in time. We are also working on getting funding for foster care disability navigation program. This is a program that the ARC has operated. We had funding for a number of years, and unfortunately last year in the budget that was not continued. So we are again advocating for this year. We have sponsors on the House side. This was a new requirement for budget priorities this year that the House Republicans put forward, but that would require a House member to sponsor any legislative asks for the budget. And so we do have a sponsor and co-sponsor that is Representative Sharon McDonnell and co-sponsored by Representative Kathy Schmaltz. And so those two individuals have been key in getting this out there and getting it in the hands of our appropriators, who will at the end of the day make the decision on what gets funded in the budget. And so this is another item that we continue to work on and hopefully see passed in our fiscal year 26 budget that we expect to see moving later this summer and early fall. And then we are also tracking items related to special education funding and our school aid categorical funding. This is very timely because we had the House Republicans present their budget recommendations for the school aid budget last week. And it was recommended that they increase the per pupil funding more so than the governor and the Senate Democrats proposed. But they were able to increase that funding because they stripped categorical funding. So the categorical funding in our state largely includes school-based health systems, mental health support, school safety funding, a number of items under those categories that fund all these different programs that schools have to provide to their students. And House Republicans took all those categorical funding items, stripped them from the budget, and then took the money that would be specifically allocated towards different programs, put that back into the per pupil funding mechanism. In that realm, they're basically giving schools the choice on what they wanted to fund in those categorical spaces. And so that's a big concern, not just for the ARC, but for a lot of groups in the state, because we are now giving schools individually the option to fund certain measures over other measures. Or they could, take that per pupil funding, backfill where they need to backfill funding within their district or within their school. And we are very concerned that this will lead to a lack of services provided to students, money going maybe where it shouldn't be funded. We should be supporting school safety. We should be making sure that students have access to hearing and vision and dental screenings. But the House Republicans' proposal would change that. And so we're closely watching what is going to happen with that categorical funding. Senate Democrats have already come out and said that, the recommendations by the House Republicans were disappointing. And a lot of members didn't mince words on how they felt about stripping the categorical funding. But, we continue to see House Republicans, not just in Michigan, nationwide, wanting schools to individually have that choice on what they should do with their funding. So at the end of the day, the Senate Democrats and Republicans will have to come together over the next about 10 days here to get a budget done by July 1st. And they will have to negotiate out these items. And so we're keeping a close eye on what this looks like and how this could potentially impact funding for students, but most notably, specifically those categorical fundings and special education funding in the state. So outside of legislative items and budget items that we're following at this point in time, we are also closely following regulatory issues. So the list of individuals that I presented at the beginning of this presentation within the department, those are individuals that we closely work with on this side of things, especially in our regulatory environment. So this includes Medicaid waivers, so any updates to submission of waivers to CMS, any policy updates that the state has, all of that goes through the regulatory side of the work that we do. We also closely monitor proposed policies. One of the most recent proposed policies that might be of interest to some of you today is updates to our children's waiver program. This policy would add 100 slots to that waiver program. It would update eligibility for overnight health and safety supports, update respite care policies, and then update CLS guidance. You will have access to this presentation online, and so you will be able to click this hyperlink and it'll take you directly to that proposed policy. And if you're interested in submitting comments, those comments are due July 3rd. Would highly encourage anyone, taking a look at those comments. You have thoughts, feedback for the department. This is a really great opportunity to be engaged in our state and in advocacy that isn't necessarily directly with our elected officials in Michigan. And so we regularly update all of you through our government affairs updates on what policies are forthcoming and when those public comment periods end. And so would just highly recommend that if you want to be engaged, but you might not be ready to meet with your legislator, hopefully you are at the end of this presentation, submitting written comments is a great way to advocate for yourself, for your loved ones, and for your organizations. We're also tracking some recent items that came out of the department, which relates to PHP procurement. So in February, MDHS issued a survey to seek input from those enrolled in Medicaid or working with the Medicaid population to identify opportunities for improvement within the PHP system. And then in May, just recently, the department released those results of the survey and indicated that an RFP process would begin this summer to allow organizations to apply to serve in that PHP capacity. So this is something new coming out of the department. We are closely following what this looks like and how this could potentially impact care in the state of Michigan. We obviously in Lansing hear both sides of two different stories of what this could potentially impact. And so we're constantly listening to those conversations and trying to understand what this could bring. We hear that this could, limit access for individuals. This is a step towards privatization of our state system. And then on the other side of the coin, this could potentially increase access to care. There are concerns about kind of the burdensome administration and kind of things getting stuck in that wage pass-through that greatly impacts the services at the end of the day that gets that individual. And so we will follow what this RFP process looks like this summer and hopefully, get a sense of where the department wants to move from there. Their goal is obviously to improve the behavioral health system. And so they'll be taking a close look at those proposals that come in to pick up, that procurement in the state of Michigan. And we'll monitor how the department moves forward in that space. We wouldn't expect to see anything get implemented until October 2026. So there's still, even though we're expecting to see this period, this comment period and RFP process to happen this summer, implementation, should there be any major changes, we aren't expecting to see until October 2026. All right. So I'm now going to jump into covering advocacy now that you kind of have an overview of the things that we're all working on in the state. And then within this realm, I'll also cover some more details on the processes, how to be engaged, and all the tools that you need to be successful. So I first want to start with the basics. What is advocacy? Advocacy is supporting a cause or an issue in an effort to educate lawmakers and build support around an issue. That involves nonpartisan research and analysis, sharing your personal stories, what's the best practice in the space or in the arena that you're advocating in. And then it can even include being invited to testify in front of committee for members to educate the larger group. So not always just a one-on-one communication. Advocacy does not always involve lobbying. Lobbying involves direct contact with elected officials in order to influence. That's proposing, supporting, opposing legislation, and having those strategic conversations about, who are the opponents, who are supporters, what strategies can we work out behind the scenes to get people to vote yes or to vote no on an issue. Lobbying also involves money. I did note nonprofit organizations fund cannot go towards lobbying activities. And to be a lobbyist in the state of Michigan, you do have to hit a threshold of hours in which you're engaging with your legislator and having these types of conversations. And so that's kind of an ever-changing number. I am a registered lobbyist, and so I kind of have the free will to have these conversations as much as I want with whoever I want. Sherry's also a lobbyist for the ARC as she's registered, so she's able to have these conversations on the ground with legislators alongside myself. But when we bring other individuals within the ARC or other organizations into the room, we do focus on that education aspect. So, having advocates in the room to talk about what the impact of this would be, making sure that the legislator understands that direct impact on the community, those are all things that don't necessarily fall into that lobbying aspect because that is education. I did want to break it down for all of you so you have a chart of what that looks like, just to make it a little bit easier to understand. Again, if you ever have concerns about, am I dipping into this lobbying realm and I'm not registered, do I need to register? That's something I definitely recommend you seek legal advice on if you are getting into that space. But at the end of the day, if you are, you know, trying to educate an individual on impacts and lived experiences and personal stories, that is that advocacy piece. And so as long as you're staying in that education and awareness campaign mindset, you will definitely be okay and moving forward in your advocacy efforts. So when we work on advocacy in the state of Michigan, and I've covered, our executive branch and our legislative branch, it's not just our elected officials in Michigan. When we do work with our elected officials, we work with our House of Representatives and our Senate. Our House of Representatives has 110 members. We have 110 seats in the state of Michigan that span all the way from the South Lower Peninsula to the Northern Upper Peninsula. And then on the Senate side, we have 38 different districts. We currently have 37 members because we do have one member. Again, there's a vacant seat in the Bay Area in the state. But we do have in total 148 elected officials that sit at the Capitol in Lansing Tuesday, Wednesday, Thursday, most weeks of the year. We also work on the regulatory side, as I covered, with our Department of Health and Human Services, Department of Licensing and Regulatory Affairs. Those are probably the two main regulatory environments that we work in. But again, we also work with our Department of Education and the policies that they release. And we do a lot of work in that space as well. So I think, a big question that I get is, especially from advocates, trying to understand why they should be engaged, who to engage with, is, why should I engage with my legislator? Why should I come to Lansing? Why should I seek time in the district to meet with my elected official? Are they going to listen to me? What's the impact? And I would list a lot of these points on this slide here today. Most of our legislators are not public health experts. They're not well-versed in the health policy space, special education space. They're not someone with lived experience. We only have a few members in our legislature who, I can think off the top of my head, who personally have a disability or have a family member with a disability or behavioral health experience that they're willing to talk about and kind of keep at the front of their agenda. And so you likely know more than a lot of our legislators do, and our legislators rely on advocates like you to meet with them and share your story. You're an advocate every day in your role. You have a unique perspective that is critical that they may not get from other organizations or other lobbyists in the state of Michigan. And then as a constituent or individual served by Medicaid or served by any state program, you have that ability to develop a relationship with that legislator that is more of that personal connection that isn't, like myself, I'm in Lansing every day. These are people, these are colleagues I work with day in and day out. You have that unique ability to create a more personal relationship with them. And so that is why when we have issues that we are working on, we are reaching out to our networks within the ARC and we're asking people to advocate. We're asking you to write letters, make phone calls, set up meetings, because we need individuals like you to share those stories to actually see the impact on the ground. At the end of the day, we hope that that legislator calls you and they say, hey, I have this piece of legislation on my desk. Tell me what this would do. How would this change your life? How would this change your family's life? What would that impact be? And that is the goal of engaging with your legislator, is that sometimes they don't know who to call when they have policy come across their desk, or they just don't really understand the bill and they're going to rely on their colleagues to tell them how to vote. But if you have that personal relationship, you can build that relationship with them and serve as that resource. All right. So being active in advocacy with your state lawmakers. Here I'm going to jump into some more details on our budget process and where we stand right now. So as we see legislation moving or we see the budget moving, you kind of understand the timing and all the different things that will come into play. So step one of being active in advocacy is knowing the landscape and having properly timed conversations. So I already covered a lot of this. Do I want to have it up here again for all of you? We have a split state government right now, Democratic Senate, Republican House. I did list leadership here just so you have an idea of who those key people at the top are. But with split state government, we are in a interesting situation this year. I believe we still only have about 5 public acts signed uh, from January to June this new legislative session. Back in 2023, at the start of our last legislative session, we had about 40 public acts signed by this point in the year. So we are, facing a drastically different landscape. And that is just the nature of having, Democratic majority in one chamber and a Republican majority in another chamber. There is resistance on moving policy, especially for individuals who are sponsoring legislation in tight districts. Senate Democrats may not want to move a House Republican bill if that's a seat that they could potentially win in 2024, in 2026. And so we're regularly kind of keeping tabs on how that landscape is changing. But right now, split state government is definitely creating barriers to getting some things done. That's not to say that things haven't been moving between both chambers, because they have. But it's definitely an interesting time this year, coming off of a Democratic trifecta to now having a Republican majority in one of our chambers. Also in our state government, something I want to note is that we have term limits in the state of Michigan. This has changed. Back in 2022, we had a new ballot proposal that would make updates to term limits in the state. And so now legislators have a 12-year total limit on any combination between the House and the Senate. And so right now we have a lot of members who will be phasing out. They'll be term limited in November 2026 and cannot run for re-election. And those are individuals who served in both the House and the Senate. Previously, you could serve, 3 terms in the House, and you could serve an additional 2 terms in the Senate. And that is now different. Now someone can serve all 12 years in the House or all 12 years in the Senate. And you can kind of create a different combination of it. So it's really just dependent on when those individuals hit that 12-year mark. And I mention this because we don't have, it's not like Congress. We don't have members who can serve, for decades in one seat. These are individuals who are limited to a maximum of 12 years, and that's if they don't get primaried or if they don't decide to, drop out and not rerun before their 12 years are up. And so when we look at individuals who are coming into the legislature, who came in, who are brand new in 2024, at the start of this year, we can assume that those individuals will be here for 12 years. And so we want to find those individuals and make sure that they are educated in the space and in policy moving that we care about within the ARC for those 12 years. And we want to find those advocates right at the beginning and make sure that we are keeping them apprised of, what changes are needed in the system, or in our state. And, how can we serve as a resource to you as you move through, the legislative sessions. I also want to highlight our budget cycle. In a typical year where we don't have what feels like kind of the weight of the world bearing on everyone, because we could potentially see drastic changes to longstanding systems in the state of Michigan and nationwide. This is our typical budget cycle. So our fiscal year starts October 1 of every year. So we are currently in fiscal year 25. Fiscal year 26 starts October 1st of 2025. And so once that fiscal year starts, we start a budget process over again. So from October to February, we see our state departments and our governor's office begin crafting the ideal executive recommendation. So the governor's team, the state budget office, they get together, they ask every state department, what are your top priorities? What do you want funded? What programs do we want to expand or get rid of? Or what new things can we put in the budget? And that is worked on for a number of months throughout the fall and the start of the new year. In February, we see the governor and the state budget office present those budget recommendations, and then that kicks off the legislative side of our budget process. So typically, from February to April, we have our House and Senate appropriations subcommittees meet and take testimony and presentation from stakeholder organizations on different items that either the executive recommendations funded, did not fund, or new items that our House and Senate members might be interested in kind of having a public presentation on. And so that is usually worked on February to April. And typically, once April and May roll around, we see those presented by the House and the Senate. So then we get an idea of what the House and the Senate want. Those typically differ. We're already seeing that is differing vastly between a Republican House and a Democratic Senate. But we will usually see these things be presented. And then by the time we get to May and June, ahead of that July 1 deadline for getting a budget to the governor's desk, negotiations will start in the month of June. Typically at this point in time of the year, we have those negotiations taking place behind, closed doors, more or less. And we would expect to see some lengthy session days in the next couple weeks here ahead of the July 4th holiday, where they will work out those additional items, and then they typically take the summer off. That is not the case this year. Again, as I've mentioned, and as all of you know, we are facing some pretty drastic items and concerns that are coming out of DC and the federal budget, which could be presented to President Trump in the coming weeks here. It could be, dragged out through the summer. We know there are a lot of things happening in DC right now. But that is greatly impacting what is happening in the state of Michigan, because our legislature cannot craft a comprehensive budget with proper revenue estimates if we don't know what is going to happen to our state's federal funding match. Are we going to see a reduced match? Are we going to see services? Are services going to have to be cut? Are we going to see programs just absolutely, cut out of the state budget in total because of what happens and what comes down from the federal government's budget? So I have blue boxes around items 4 and 5 because we are kind of in this weird space right now where we are coming up on July 1st, but we are still in this phase where the Senate has introduced their budget proposals. We know the Senate wants to fund. Those have already been passed out of their chamber. The House has only presented a school aid budget. So we have not seen any other subcommittee budgets presented. We are expecting to see those throughout the summer months, more likely going to see those in August. And then, really our legislature will have until October 1st to pass a budget, or else we enter that government shutdown phase in the state of Michigan. And so we recently had a consensus revenue estimating conference. That conference meets twice a year in February and in May to give updated revenues to our legislators so they can craft their budget proposals. Again, unfortunately, because of what's happening in DC right now, we don't really have a clear picture on those numbers. We have our state revenues. We know what taxes are available. We know what general fund dollars are available for a legislature to work with. But at the end of the day, that can drastically change depending on what happens with Congress's proposed budget. And so we are in this weird period where we're waiting for Congress to make some decisions so we have a better understanding of what money we have to work with in the state of Michigan. There's a chance we could see in August or September another consensus revenue estimating conference. The last time that happened was in 2020 during the COVID-19 pandemic, when we had increased uncertainty around our state revenues. And so we'll continue to monitor the situation and keep an eye out for what's happening. But I want to make sure that all of you had an image of what a typical budget year looks like, so you have an idea of when to have these conversations with your legislators. You want to have those conversations in key times. We know that pretty much April, May to July 1 is a really tough time for policy to move because we are so focused on the budget. And then in a typical year, we do have July and August. It ends up being fairly quiet in Lansing with our legislators in district. But that's expected to change this year. And so I wanted to add the nuance to this conversation because it is so important that you all understand kind of what Michigan's facing right now. But also kind of getting a sense of, why things might feel like they're moving slow right now in the policy space. And it's because we have so much uncertainty around the budget and needing to iron out some details before our legislature makes some decisions on how they will fund school aid and our general omnibus. I won't run through every detail on this slide, but I want to make sure that you all have an understanding of how a bill becomes a law. honestly, I recommend just looking up the Schoolhouse Rock video of I'm Just a Bill. That's a really great way to get a grasp on how legislation moves through the process, because it is very similar for what happens in DC and Congress and what happens in the state of Michigan. And so happy to answer any questions on this as we move through the presentation. But just want to make sure you all kind of have a chart of what this looks like and how the process works. All right, so now that you kind of have an overview of our legislative branch, the current budget landscape, and what a typical budget year looks like, I also want to run through how to connect with your lawmakers. And so first thing you should do is know who your legislator is. I do have a QR code here that can make it really easy for all of you to quickly scan this with your phone and find out who your Michigan State Representative and Senator are. Your state senator and representative are different from your US representative and senator. And so I do want to make sure that you all understand the difference between that. I am a state lobbyist and working on the state level. And so I am regularly working with our 148 elected members in the state of Michigan, and not with those individuals in DC. And so while a lot of Medicaid and Medicare conversations are happening federally, we are taking those items that we're hearing and bringing them back to the state level. So as you scan this QR code, make sure you are identifying those state lawmakers and not the individuals that serve us in the nation's capital. When you are connected with your lawmaker, you can do this in a lot of different ways. You can meet with them in district or in Lansing. Coffee hours are a big one. A lot of legislators will post those throughout their newsletters. So if you sign up for their newsletters on their website or social media, they may post it on social media as well. You can attend those. A lot of our legislators also have virtual coffee hours. So you can log on to a Zoom meeting and hang out in a virtual room like we are today and be able to chat with your legislator. You can do office visits. Few legislators, have those in-district offices outside of an election year. And so they may be recommending that individuals come to Lansing. And if you're able to come to Lansing, it's a great way to engage with your lawmaker. And that goes for advocacy days as well. There are a lot of organizations across the state that offer a full day of advocacy where they take your information, they find your legislator, and they help set up meetings. And it's a great way to meet with your lawmaker and kind of have everything set up for you in order to advocate for the priorities that you care about. You can also send letters and emails. You can also offer site visits or facility tours. And then, again, signing up for newsletters or following them on social media is a great way to stay engaged and make contact with them. So when you're setting up a meeting, I wanted to make this as easy as possible for everyone, especially for individuals on today who may not be familiar with contacting your lawmaker or their office, or who just might need a little bit of guidance in that, taking that next step to doing so. So whether you're setting up an email via phone or email, I wanted to list out a couple items here for you. I think the biggest thing is just make sure that you have an introduction. Mention if you're a constituent. Do you live in their district? Do you work in their district? That helps kind of prioritize emails for the office. They will prioritize individuals that are living in their community. And so that's always really great information for them to have if you're comfortable sharing your address or, location of residence or work. And then the other key item here is make sure that you provide a reason for contacting, but I would recommend if your goal is to have an in-person meeting or a phone call, do not give all the details of your conversation in that email or over the phone, because if they have all the information, they might reply and say, thank you so much for your concern or your thoughts. We'll reach out if we have any questions. If you want to be a really great advocate, you want to work towards setting up time to talk with them face to face. And so putting enough detail in the email so they have an idea of what you want to talk about will be helpful for them so they can prepare for the conversation, but you're also not giving them all the information up front. You want to leave them kind of looking for more. And so that's probably, those are the two key items that I would recommend to all of you when you are looking to make contact with your legislator. You also want to make sure you're prepared for your meeting. So make sure that you're doing some self-education on your legislator and their priorities. That will prepare you the best. You can, on their website or social media, learn a lot about the individual, learn about, what they care about, what are they posting about, who are they engaging with. All those things will kind of give you some insight onto who they are as a person if you do not know them. You also want to understand what is in their district and what's happening. So what cities are in their district, what is being reported locally in the area. That can also influence what they really care about at the state level. And they also want to make sure that you're kind of following the current state of politics. So following our advocacy updates, checking out your local news politics section or government section. All of those are really key in understanding kind of what's happening. Are you having well-timed conversations? Are you meeting your legislator at a good time where they don't really have a lot of other things going on that's public? That's a huge component to making sure that you're prepared for conversations. And then depending on the issue at hand, if you want to talk to them about guardianship or supported decision making or voting, are they talking about it in Lansing right now? Has there been legislation introduced? Has there been committee hearings? Is it a local issue or is it a personal issue to them? All those things will be key in understanding ahead of your meeting. So as I covered our legislative, updates and the budget updates, you want to make sure you're meeting at the right time. You want to make sure you're not meeting them in June when we don't see a lot of policy moving, but budget conversations are the priority. If your priority is a budget item, this is a great time to get in with your legislator and have those conversations. But if you want to talk about a policy issue that you'd like to see the legislature consider, or an item that has been introduced but hasn't had a committee hearing yet, it may not have one for a couple months, it might not be the right time to have that conversation. Legislators have a lot of things going on, a lot of things that move across their desk. And so you want to make sure you're meeting them at the right time where it's going to stick with them and it's going to be something that they're able to take action on within a relatively close time frame from that meeting. Make sure you're prepared by being confident in your personal experience, your expertise, know your story and what story you want to tell. Bring any written materials if you have it. Don't be afraid to have talking points or written notes with you. I think that shows that you're prepared and you're ready to have a conversation. You have information to back up your points. So don't ever feel like coming to the meeting with a notepad or different items makes you feel one way or another. It shows that legislator that you are ready to have the conversation and that you're knowledgeable and you're ready to bring things to the table. And also be sure to practice. Practice with yourself in front of a mirror, with a colleague, with a friend, with a family member. Practicing what questions could come up in your meeting. Just practicing your story in general with someone else. That is a really great way to make sure that you're ready to have that conversation and that you're confident in what you're going to share. So the foundation, you want to develop your relationship. And so when you're having these meetings, make sure, again, you have an introduction, find commonalities, make a personal connection. We have new legislators come in and our team meets with these new members. We introduce ourselves and the work we do at our firm. I'm always looking to find that piece that I can connect with this person because a new House member, they are meeting 109 other colleagues. They're learning how to be a legislator. And then they're also meeting hundreds of lobbyists and state organizations who all have a different priority coming to the table. And so finding a commonality or that personal connection can really make you stand out. I think of one legislator in particular who just started this year and, he is in a district that the only personal connection is that, my grandparents used to vacation out there. And so I brought up a local ice cream shop and now when I see him, we're able to make that connection, chat about how the district's doing. I ask about the ice cream shop, if there's anything new happening in town. And that helps him remember, who I am and the work that I do and the individuals I represent in Lansing. And that, is that personal connection that not a lot of people can bring to the table. So always make sure you're trying to find something to talk about that'll help you stand out in the crowd of hundreds who are, knocking on these legislators' doors every day. You want to make sure you have a clear message. Again, timing, schedule your meeting proactively before and during the height of an issue. You don't want to come to a legislator after a House bill has already been passed out of the House. That's not, great timing. And so following bills through the process and keeping up to date on government affairs updates All those things will be great in making sure that you're proactive and having those properly timed conversations. You also make sure you're concise in your conversations as well. It's really easy to go into a meeting wanting to talk about one thing, and then you kind of get on a tangent, and you may start talking about something else. And that may impact how the legislator understands your issue and what you're advocating for and what you want to talk about. And so always make sure that you're concise in your messaging as well. Strategies and tactics. Again, strategic and properly timed conversations. I think this is the number one thing. I'll probably reiterate it a couple more times in my presentation here. That is key in making sure that you are having, a great strategy behind your advocacy plan. You also want to make sure you're proactive in your conversations, but you also want to be reactive. So reacting to how the legislator may feel about a policy issue or a budget item, questions that they're asking you. In that realm, don't be afraid to say you don't know. That's probably honestly one of the best things that you can say in your meetings, because it's going to prompt follow-up with that legislator and continued connection and conversation. You want to make sure you're prepared to compromise. If that's the case, if you're talking about a policy item that is contentious and a legislator says, listen, you can't get me here on this issue. I'm hearing concerns from this person and concerns from this organization. That's if you're coming in support of the bill, or even if you're coming in opposition to the bill and you're asking a legislator, this bill would have devastating impacts, but they're hearing, I'm hearing that this thing is really going to change lives, and here's the positive things I'm hearing about it. Be prepared to compromise. If you are aware that the conversation might not be going in the direction that you want it to be, and they might not be in agreement with you, are there items that we can compromise on? Are there things, is there language changes that we can make? How can we find a place to get to kind of a meeting ground, and we can kind of level the conversation? So always be prepared to have that in your back pocket if that's something that, ends up coming up in your conversation. And then in that same realm, be flexible. That's being flexible in a number of different ways, which includes meetings, especially those in Lansing. Our legislative agenda is always changing. Again, we are one of only a few full-time legislatures in the country, and so the agenda at the state level is always changing. Some days it might be a Wednesday. We think everyone's gonna be busy. We're gonna have a lot of things happening, and then something changes the agenda. We don't have legislators in Lansing having conversations. And so always be flexible with the agenda. And that also includes just your meeting times. You may be set for a meeting at noon. A legislator might get pulled into another conversation, and their agenda's, largely out of their control. And so their agendas can change. And so always be prepared to change meeting times, have to wait or shorten your meeting. But also you might not be meeting with the legislator themselves. You might be meeting with staff. I mentioned term limits earlier. Staff do not have term limits. We often see staff stay in a district office, and that elected official just changes over every time. And so we have a lot of staff members who have far more experience and knowledge on issues than our legislators do. And so meeting with staff is just as important, if not more important, at times than meeting with the legislator themselves. After your meeting, you always want to make sure you're following up. I had mentioned earlier, if you say you don't know, that is not the end all be all. Biggest concern to happen in a meeting. It's actually a great opportunity to follow up with that legislator and provide additional documentation or information. If you're able to handwrite a note or send a thank you email or phone call, that's always a great way to stay in connection with that office. And then even after your meeting and even after follow-up, if you can establish consistency and continuity with the office, you can continue just to follow up, say, hey, I'm still here as a resource, or hey, I'm hearing about this thing in the district I want you to be aware of. I really care about this issue. All of those are things that will help build that relationship that you can have with your elected officials. So again, continuing to reach out to offices. You can also stay up to date on what they're doing in Lansing or in the district. And so if you're able to attend events that they're hosting or attending, that's a great way to engage with that lawmaker. That includes volunteering. It also includes fundraising, or during campaign season, door knocking or making phone calls for phone banking. If you're doing that in your own personal capacity and not on behalf of your nonprofit that you work with or organization, you won't get into that advocacy versus lobbying realm. And that's also your personal choice to do so. And so if you are so inclined, that is a great way to support your legislator. If you do, believe in them and that's an individual that you vote for, you shouldn't hesitate on being supportive in that personal capacity. All right. And then step 3, I did want to outline, what does it take after you've established this relationship with your lawmaker or you're asked to testify? What does that mean? How does it mean to not just do advocacy on one-on-one meetings or emails or phone calls, but what does it mean to sit in front of a group of legislators and provide public comment? So committee testimony. Every time we have a bill move through a legislative process, they will get at least 2 committee hearings, one in the House and one in the Senate. And so if you're interested in being on the record in support or opposition to an item, you can fill out one of these cards. They are in the committee room when you show up in Lansing. When committees are posted, you also have the opportunity to email this virtually. And so you can easily email the clerk if you need to and fill in your information and just be on the record in the minutes that are recorded online. But whether you want to speak or not speak, you will have to fill out one of these cards. So if you do speak, you absolutely have to fill out one of these cards. And so you'll want to put your name, your position on the bill or bills that you want to talk about, and then time needed. Typically recommend 5 minutes or less. It really depends on the day and the agenda. Anywhere from 3 to 5 minutes is usually a pretty great time to provide comments if you are wishing to speak on an issue. So if you're looking to speak and you haven't done it before, I did want to give you a glimpse of what committee rooms look like. So on the right-hand side here, this is our Senate, one of our Senate committee rooms. You can see there's a small desk here with some microphones. That is where the individuals wishing to testify will sit. And then you have your panel of legislators in the front of the room. The bottom picture is one of our House committees in the Capitol. And so this is a little bit bigger of a room, but you can see there is this table with a number of individuals who are testifying in front of a full committee of members. And so when you're providing testimony, whether this is oral testimony or written testimony, you always want to begin with the introduction, giving thanks to the chair and committee for taking up this item or giving you the opportunity to speak or provide written comments. You do want to mention if you're a part of an organization or if you're there on your own personal capacity, your name, your location of where you reside or work. You do not need to put a full address, but it does help to mention specific cities or counties to give our committee an idea of where you're coming from in the state. And you also want to make sure that you explicitly say if you're in support or opposition to specific bills that are in front of the committee that day. You also want to offer an overview of the issue. I think the biggest thing here is make sure that your perspective is different than what other people might say. If you know that you have people speaking in support and opposition, and let's say you have provider groups speaking, as an advocate, what can you say that is going to be different than what all the other potential speakers could say? And that will make you stand out. Sometimes we have committee where we have groups go up and talk in support or opposition. They all kind of say the same thing. And you can see legislators tune out to that a little bit. They may not be as interested if it's not anything new that they're hearing. And so if you can pull that one item that is going to be a little bit different than what anyone else might say, that is really helpful in establishing connections with the legislators, but also making sure that your story is heard and that legislators are paying attention. And so you want to make sure that you're covering the real world impacts to yourself, your family, your organization. All those things, those real world stories will make a really big impact on our legislators. And then once you have your introduction, your overview of the issue, you do want to conclude so you can wrap up your thoughts, restate your position on the issue. Always offer collaboration going forward. I know, there are times when we have legislation where, there may not be a compromise. There may not be room to change the bill. There isn't we will support this if you do this, or we'll oppose this, or we won't oppose this if you change this one item. Sometimes that's not the case, but you do want to offer collaboration going forward because that opens the door to further conversation with our legislators. And that's also something that if there isn't going to be collaboration, that may discount your, perspective and your story a little bit if you're kind of taking that hard stance. Sometimes that is the only case, but offering any collaboration going forward is at least opening the door to meetings and having those conversations outside of the committee room. And then always be sure to give your final thanks as well to members. A couple tips here, dress for the occasion if you're able to. If you're verbally testifying or providing comments, come with written copies for members. You are able to find who sits on the committee on one of the links in my previous slides on how committees work. You can figure out how many members are there, how many copies you might need. And just in your meetings that you might have individually, be prepared to answer questions by saying, I don't know, or I can follow up with you. That's always a suitable answer. And it's a great way to deflect if you don't have an answer to something, or you are not ready to speak on that issue in front of members. Saying, I'd love to follow up with you. I'd be happy to have this conversation outside of this room when we have more time to engage. Those are really great ways to continue the relationship, but also continue your advocacy. All right, so I hope this was helpful for all of you as you get ready to get involved. If you haven't already been involved, I'm sure many of you have been on the federal level. But as we hopefully start to see some more policy moving when our legislators get the budget done these next couple of months, we'd love to make sure that we have advocates who are ready to advocate and have conversations with their lawmakers and testify in committee. And hopefully this made it feel like this isn't a really big item to conquer. This is something that we see people, they maybe not even have a prep like this. They, just really come into the room and they just start speaking and telling their story. And it's a great way to get engaged. And so if you want to get engaged today, I do have that QR code up here again to identify your state lawmaker. And if you are so inclined, feel free to start sharing your stories today. Start emailing your lawmakers about Medicaid impacts. Start emailing your lawmakers about concerns in your community. That initial outreach is probably the scariest part. And then after that, it's smooth sailing. Legislators are people just like you. They come work in Lansing, a couple days of the week. But at the end of the day, they are families in the community, individuals in the community who not all of them have a lengthy political background. So they actually might have less advocacy and legislative engagement than you may have. And just remember that as you move forward in advocacy, and would encourage all of you to take that first step today if you're so able to. All right. I am happy to answer any questions anyone might have. All right. And I apologize, I was not able to see the chat as I was writing through my presentation. So I am gonna run through some of these comments. One of the questions is, what is PIHP the acronym for? PIHP is our prepaid inpatient health plans. And so that is what I see someone replied to that. Thank you. So that is part of our community mental health system in the state of Michigan. Lots of great comments on what the PHP and the behavioral health system is. Thanks, everyone. Elliot asked, I believe I heard that Michigan's budget timeline's a little later than many other states. Are other states looking like they're heading for the shutdown situation, and what are the impacts? So I am not keen on what some of our other states look like. I know some states have different timelines than Michigan. Again, we are only one of a few full-time legislatures, so we are in a unique situation. But I would imagine that a lot of other states are in the same boat. A lot of states are waiting to see what is going to happen on the federal level and how that's going to impact the money available to the state of Michigan. So I can't confidently say we're going to enter government shutdown. I would like to think that, we have legislators who have been around for a while and they don't want to see us in that space. On the state level, a shutdown isn't as scary as what a federal shutdown looks like. We have had a number of shutdowns the past decade in the state of Michigan. They typically last the weekend and then they find resolution over, a period of time. And so I think, we expect to see the budget process play out throughout the summer. we can, at this point in time, expect to see our legislators come in throughout July, August, and September to continue to have these budget conversations. But, I can't say for certain we're going to have that government shutdown, but if we do, what we've seen in previous years is the impacts have not been uh, very drastic or as drastic as what we see on the federal level when we have a federal government shutdown. And so we'll continue to monitor the situation. If you haven't signed up for the ARC's government affairs updates, we send those out typically on a bi-weekly basis, depending on how active our legislature is and what's happening in Lansing. But we hope to cover all those items related to the budget in those updates moving forward. So another question, what's probably happening is that we have to craft a budget for both scenarios. One, if there won't be cuts to Medicaid, SNAP, and Social Security, and one, if they are planning like there's disaster planning. So we typically don't see more than one budget recommendation. We see the House and Senate put forward their own versions of the budget, and then they'll come together and negotiate. We saw the Senate introduce their budget recommendations before the May Consensus Revenue Estimating Conference. What we actually saw was that the Senate proposed spending more money than the governor had proposed spending. And we, in that Consensus Revenue Estimating Conference, learned that we do not have that money to spend, even without federal impacts. And so we already know the Senate's proposal is bigger than what Michigan is even able to spend starting October 1. And so that's why we're seeing the House kind of slow roll some of their budget recommendations, because they want to wait until they have a better grasp on the financial situation before they put anything forward. So I guess in a way, we're kind of seeing these two different proposals. We have the Senate and governor's proposal out there. They know what they want to spend, but the House is waiting to have that more conservative approach to spending in the state. And then once we see two proposals come forward, there is a select group of individuals who will sit down and negotiate out. They literally go through all hundreds and hundreds of pages of the budget, and they go line by line, and they talk about every item with our state budget office and with our department heads and officials. And so I guess that's more or less disaster planning. They could take their proposals and have to gut things from that. But we will still pretty much only see a House and Senate proposal that they will then sit down and negotiate through the process. All right, so another question, is the process similar when meeting with the administrators or regulatory folks? So when you're setting up meetings with the regulatory individuals, it's very similar. These are also individuals who are just like you. They have a state job, but they still have issues that they personally care about. But they are being, guided by internal policy and internal leadership on, where they might stand on an issue. But at the end of the day, when they have public hearings or they are looking to get feedback from individuals, it's same as the legislative process. They don't have public hearings, at least like MDHHS, we don't have public hearings like we do in the legislature. But written comments are still very similar. You still want to, kind of introduce yourself if you're speaking as an advocate, as someone with a loved one with, disability or behavioral health concern. That's all really important for the department to know when they consider public comments. And then, it's pretty much along the same lines of make sure you're covering the topic completely and sharing your story. So it is very similar meeting with administrators and regulatory folks, yes. Another question, if you have legislators you already know who are very sympathetic to your view, do you keep contacting them anyways just to show your commitment, or is that not well received? Definitely well received. I work in the vein of you want to make sure you're hitting these legislators as much as you can. If you're already working with a legislator and they say, thanks for contacting me on this issue, I do care about it. Maybe your follow-up again isn't, hey, I'm just letting you know I still care about this issue. Maybe the follow-up is, I'm hearing that, so-and-so has a concern, or, we have concerns that this might be trying to happen behind the scenes. All those things, like kind of additional insight, that'll be really great follow-up. Because if a legislator says that they care about it, then your follow-up is trying to push them to get other people to care about it. So taking your advocacy position and making them the advocate in that scenario, that'll be really helpful. I wouldn't recommend sending a plethora of emails back to back if you know they're in support, but just that additional follow-up, how can I support you, the legislator, in making sure that, we have the right people in the right place saying yes or saying no on the right thing. Legislators, if they want to be collaborative and they do really care about an issue, they will lend that insight. They will say, I have this legislator out in this county who I know really doesn't like this. Maybe you can talk to them and share your story. That'll be important follow-up, instead of kind of just reiterating the same message over and over again. All right. Do I know the status of House Bill 6126 and 6127, coverage for the diagnosis of autism spectrum disorders and treatment of autism? Will they be introduced? I will take a look at these bills and see. I don't think we've had reintroduction this year. We typically see, though, that if bills were introduced at some point in time, they always make their way back around. And so if they are coming up, those will be in our government affairs updates moving forward. So I would recommend that you sign up for those GA updates, and definitely we'll keep tabs on this and make sure that that's provided in any updates going forward. What are some good sources to keep informed about issues and laws for advocacy? Your local news is a great place to start. Some websites I recommend that don't require a subscription. Bridge, Michigan is a really great resource. They have a wonderful government affairs team that cover a lot of different policy items moving in this space. Within my PowerPoint that you'll have access to, there's a resources slide. There's a guide for citizens on how the government works, how bills become laws, and what is entailed in that process. And so I definitely recommend looking up those resources as well. And then some other news sources, the Free Press is another great one, Lansing State Journal. There are some paid subscription sites, but I know those aren't always accessible to everyone. So I definitely would recommend Bridge and Free Press and Lansing State Journal as a place to start. And then really just honestly keeping tabs on our Michigan legislative website. That's also linked in the resources that will be provided in the presentation. If you can get familiar with the website, it's pretty easy to follow and keep an eye on, but you are able to search bills that are moving. You can search our committees in the state legislature and look up the minutes and people who provided testimony. A lot of bills that move through the process, once they are scheduled for a committee hearing, our House and Senate fiscal agencies and legislative staff provide kind of like a one-pager on what the bill does in summary, who's in support, who's opposed, what the fiscal impacts are. And those are also really great resources as you're trying to understand the process and understand, how bills work. Diving into that website is a really great place to start. If we go before committee lobbying for a particular piece of legislation to be passed, can we write down the organizations we volunteer for credibility purposes, making it clear then that you are there in your individual capacity? That is something I'd always recommend talking to those organizations about. I think about some groups that I work with. I work with different physician groups, and they are part of a nonprofit organization, but they may work for a health facility. And maybe that health facility isn't supportive of the legislation, but the physician and the nonprofit is. Typical guidance from my side and from the health facility side would be the physician not mention what health facility they might be at, because that can kind of construe the message a little bit. And so if you have the thumbs up and the okay to mention, what other groups that you work with, I think that's a really great place to start. If you're just in passing mentioning, I volunteer for this group, to show that you are committed to the issue, I don't see how that would be a problem. But again, I would always lean back on that organization or that stakeholder group that you may volunteer or work with to make sure that that is something that is okay to be shared. On the flip side, what if you have someone who refused to meet? How do you handle that? That does happen. I think really one of the only things you can do is just say, thank you for considering my call or my email, if they respond to you. If they don't respond, they don't want to be an advocate in this space. And I honestly wouldn't recommend wasting the time and effort that you are taking out of your life and your day to try to engage with a lawmaker who isn't willing to engage. We have a number of lawmakers, a handful of lawmakers in Lansing who, they're very, very difficult to reach. They don't do community engagement. They don't respond to emails or phone calls. And it can be very frustrating, but I would recommend looking for another legislator that may not be your legislator, but maybe in your surrounding district, the surrounding district or areas. That's a really great way to still engage with people in the, people that are served by their, in that community and that may vote for that legislator, even though it may not be that exact person that, the district that you reside in. So it's very difficult and it might feel really disappointing at first and frustrating, but unfortunately, at the end of the day, these legislators are people and that's how they work. But they were elected to office and they may not be as responsive as other members, but I would just recommend finding someone else in the area to engage with and just make a note that that person's not an advocate and you may not be able to sway them on the issue anyways. Courtney did put the link in the chat to sign up for government affairs updates, so please keep an eye out for that. If the legislature lumps categorical school programs into the per pupil allowance, do you have suggestions on how to do budget advocacy with school systems? I think this is still a really big question a lot of us have, unfortunately. It is going to be a local effort. When we have categorical funding in our state school aid budget, it takes the pressure off advocates of having to go to school building and district to district and have conversations about what, public comment, providing testimony on what our schools should be funding and what they shouldn't be funding. And so this, unfortunately, if the legislature does decide to take categorical funding and put it in the per pupil funding mechanism, it puts a huge burden on advocates and locals to become those advocates on that local level. And so I think advocacy is still the same. You'll still reach out to your locally elected officials, your school board, and have those conversations. If you have a child who goes to one of these schools, if you're part of PTA, all those things would be really important moving forward. I will say, just based on what our Senate Dems have said in response to the House Republican budget, I don't see a place where the Senate Dems would remotely agree to stripping the categorical funding. We could see some programs cut in an effort to find some common ground, but I don't know if we will, I highly doubt we'll end up seeing all the categorical funding stripped and put into that per pupil mechanism. But advocacy is going to be very, very much similar as it would in the legislature to the local level. Unfortunately, just be more burdensome. Yep. And then Courtney also put the links in the chat for recorded sessions and previous video sessions. All those are in the chat as well. I will give it a minute, see if we have any other questions in the chat. If there are any additional questions that you may have outside of this conversation today, please feel free to shoot myself or Sherry or anyone within the organization an email. They will eventually make its way over to me if you don't have my email. But we want to be a resource to all of you. Advocates in the grassroots network, which is all of you on the ground in the community, you make the biggest impact. The legislators see me every day. They know where my clients stand in the work that we do with the ARC. But when they hear from people from their district calling them and emailing them, that is what makes the biggest difference. And that is what changes the mind of legislators, that constant notification and emails and calls of issues happening and solutions that can change the state of Michigan and better the state. That's what they want to hear. And so all of you really make the difference at the end of the day. One more question. If Medicaid is cut at the federal level, how do we avoid advocating for our constituency only? So right now, I don't think we're expecting to see Medicaid completely cut on the federal level. We could see some barriers put in place related to work requirements, which would be a huge burden on a lot of individuals. And we could see some changes to Medicaid rates and matches. And, at this point in time, what we've been hearing from the department in their public testimony is that they'll have to consider three things. Are we cutting programs and services? Are we cutting people from receiving those services? Or are we cutting reimbursement rates? And so we will continue to monitor what that situation looks like. And you don't have to only advocate within your constituency. As a part of a larger advocacy network, I recommend you reach out to as many legislators as you'd like. It's just always helpful to start in your local networks with your local legislators first before you kind of expand out to the rest of the state. But absolutely recommend reaching out to as many legislators as you'd like. And then, working with your networks and making sure that you are dividing and conquering the state is always super helpful. That's something that I know when individuals in the ARC reach out to you and ask you to advocate on behalf of an issue or reach out to a legislator, that's kind of our way of dividing and conquering to make sure that we're covering the ground in the state. I hope I answered your question, Claire, but if that wasn't clear, please feel free to follow up. And then I believe my email is online, but I will put it in the chat for everyone as well. And if you have any questions about how to engage in advocacy or legislation, happy to try to provide as much information as I can to all of you.
Thank you so much, Emily, for answering all of our questions and providing that great update. Thank you to all of our other presenters who've joined us. Be sure to save the dates for next June. The ARC Michigan Disability Policy webinars are usually Fridays in June. So save those dates, and we look forward to seeing you next year. Thank you, everybody, and have a great rest of your day.